This Good to Go segment is made possible by Spectrum Health Medical Group.
Breast cancer is one of the most common cancers in women in the U.S., affecting 1 in 8 women during their lifetime. It's the second most common cause of cancer death in women and the main cause in women 45 to 55 years of age. Spectrum Health and the American College of Radiology urge women to get a mammogram every year starting at age 40. And here to talk more about breast cancer are Dr. Jennifer Johnston, a radiologist with Spectrum Health, and former breast cancer patient Amy Flynn. And it's good to have you both here.
Thank you.
Nice to be here.
Let's dive in on this breast cancer. You know, every October we try to shed as much light as we can, and we look for anything that may have changed from one October to the next. You're saying mammography, or get your mammogram, 40
years old is what the recommended age is for initiating breast cancer surveillance. So you should be getting your mammogram every single year because that has been determined to save the most lives.
There are some risk factors that's important to let folks know about.
Yes. The greatest risk factor would be a genetic predisposition. So if you know that you have a strong family history of breast cancer or even other cancers, not necessarily breast cancer, it's important to let your provider know so they can do a risk assessment for you to determine your initial risk. Other risk factors include obesity or smoking, things like that. They're less significant but do have an impact on your breast cancer risk.
Spectrum Health has certainly made access a non-excuse, right? Because they really make it possible for women to get the help they need.
Yes, they have grants available for women who have financial difficulties in being able to acquire their mammogram or get any diagnostic workup that they need coming from that. Also, we have several places to obtain your mammogram, ones within buildings, and then we have several mobile units throughout the Grand Rapids and Western Michigan area. You can just walk right in, you don't even need an appointment to get your mammogram.
The other thing is technology. Certainly we have seen technology change over the years. Diagnostics have become easier, more precise.
Yes.
Talk a little bit about that and what you have at your disposal, even in those mobile units.
Yes, and so we have the conventional mammogram, which is an X-ray picture of the breast. We do 2 images of each breast. And then in addition to that, we can do a 3D tomosynthesis mammogram. And that is essentially like a 1 millimeter section through the breast. And it just adds a level of sensitivity to the mammogram, especially for women who have dense breasts, because that tissue overlaps one another and then they can hide small masses or small changes. And so it adds a level of sensitivity. And those 3D mammograms are available both within our buildings and at our mobile units.
Very nice. Okay, Amy, you've got a story to tell us. A breast cancer survivor, former patient.
Yep, former patient. 2 years ago this week, actually, was my diagnosis. And it all kind of started with me finding a lump in my breast. It had been a couple years since I'd had a mammogram. And just thought, well, you know, is it something, isn't it? Let me just make that appointment and get it done. Pretty quickly, they called me right back and said, you need to come in and have the 3D mammogram and possibly an ultrasound. And the doctor, the radiologist came right in that day and said to me, yeah, I'm pretty sure you have breast cancer. So
rocks your world, right?
Yeah, because at the same time, my husband had 2 seizures, which he had never had before, and had what they found was a brain tumor.
Oh my goodness.
And so he had just had brain surgery, and we found out, the same week we found out he did not have cancer, that his was non-cancerous. That was on a Monday. On Friday we found out that I had breast cancer.
Oh my goodness. Well, it's good to have you sitting here with us.
Thank you.
2 years out. If you want more information about Spectrum Health's breast cancer detection services or to set up an appointment, contact Betty Ford Breast Care Services at the number on your screen. You can also read more about Amy's story online, 13onyourside.com. Thank you.
Thank you.
Thank you.